Let's look at a bunch of techniques that might help us recover. Oh, that's not a very good colour, I don't think. Let me lighten things up. And let's do the following things. Let's evaluate those techniques. And of course, we're looking at recovery here. So let me just dive straight in and give you an example of one that might get us off to a great start. Well, we are interested in active recovery. The idea that, first of all, we perform some kind of cool down after our session, but more importantly, this could be active recovery during the session, within recovery periods, so rather than just stopping, but doing a little jog or a little stretch, etc. But also that we main some kind of activity between sessions as well. Why would this be useful? Well, it decreases DOMS, and this is the delayed onset of muscle soreness. It also decreases EIMD, exercise-induced muscle damage. Fantastic. Also, it can be described. Let's say that someone who's undertaken resistance training is also cycling to and from work or to and from the gym. They're undergoing what's called peripheral training. Peripheral training is sort of additional lifestyle-based training, which is at sort of low levels, non-sort of measured, nice and simple. Really nice sort of features of high-quality athletes will be things like that. Secondly, you might be wondering what the hell I'm talking about here, but let's talk about self-myofascial release. Myofascial release. Now, it's not quite as exciting as it sounds. What we're talking here is the use, and I'm sure some of you have done this, of things like foam rollers, of things such as, a classic example, things like massage guns. And think about this as sort of like you can kind of self-massage in a funny sort of way. Now, what's this really good for? It gives us a big benefit, and it helps us to remove toxins. So if we say toxin release, that is a really, really good benefit of this. And also, it increases relaxation. So that sort of deep tissue massage, which can of course be really great for injury prevention, sensory relaxation, freeness of the muscles, looseness of the muscles, extensibility of the muscles, all good for us and very, very positive. Let's take things further. Let's talk about compression garments. These are for recovery, post-exercise, perhaps between sessions. We might even sleep in these things, for example. What's the idea of them? Well, the idea is that they increase venous return. Now, if you're not sure what venous return is, it is the quantity of blood returning to the heart. Now, venous return directly informs our stroke volume. So venous return, Starling's law, equals stroke volume. So venous return and stroke volume, the same value. So if we get more blood back to the heart, there's more blood ejected from the heart, stroke volume. Therefore, we get more blood flow. So as a result of this, we get an increased resting SV. Well, this is the theory at least. Therefore, we're able to get further kind of capillary flushing. So the tissues that have been working, the muscle tissues that have been going through our training, for example, the idea is that they're flushed more effectively with blood. However, this is not clear. We need more evidence required to prove the effectiveness or the decisiveness of these things. It certainly won't do you any harm unless you sweat to death, but there's no clear sign. I think sometimes it's a bit of a trend, and it's a bit of a sort of a cool thing, isn't it, that people might use that. Now, let's take things further. I'm going to go over here, and I'm going to talk over here about cryotherapy. Now, this is not the thing where someone just before they dies, you know, Walt Disney and that, you freeze them and then you bring them back Han Solo like further down the line. No, this is a different model. That's cryogenics. Okay, what we're talking about here is that a person will go through this process. First of all, they'll go into a holding chamber, okay, and that holding chamber will be very, very cold. But they only stay in there a few moments. They've got to acclimatise. That could be minus 20, 30 degrees, you know, a really, really cold holding chamber. And then what they're going to do is they're going to transfer over to a severe cold environment. And this is going to be far colder. And they will stay in there typically no longer than 2 minutes. But that severe cold, what that's going to do is that the next stage is it pushes cardiac output to the core. So effectively, all the blood vessels leading to the skin, for example, to the muscles, will be pushed, it'll be redistributed back towards the core of the body to maintain body temperature. Then what we do is we return to room temp. And by the way, people wear gloves, mask, elbow coverings to do this because you don't want to damage things, but people will return to room temperature. And what then happens in sort of stage 5 of this is that blood flushes back through the tissues. So again, the idea is to get rid of any residue of waste, of toxin that's built up in the work muscle, and this system will flush those out. Now that would be the same with something like an ice bath. It's just the cryotherapy is thought to be a little bit more impacting, but ice baths will do exactly the same process. Now then, the nice little light brown colour here, I just want to talk to you about hot and cold therapies. Hot, cold therapies. Now I grew up in the north of England, and it sounds like our weather conditions, but nevertheless, what we're saying here is that we'd have repeated cycles of hot and cold compressions on a particular part of the body. So think ice pack, sort of hot arm, hot press. And why would we do this? Well, first of all, it allows localized treatment. And what I mean by that is that you can get this onto your elbow, onto your thigh, onto your knee, onto your muscle strain in the side of your body. It's a localized treatment. And what it does, it exaggerates thermo effects. Okay, so what we're saying here is you get that kind of a decreased swelling and inflammation of the cold side of this, but also the thermal effect. Remember that when you apply something hot to the body, then the particles in the cells below that they become more active. They vibrate more kinetic energy, and therefore things like recovery processes and what have you can be sped up slightly. Now, I want to finish this off simply by talking about sleep. One of my favorite topics, and sleep for recovery is a fantastic way to think I'm justifying an afternoon nap. So here's a couple of things that you need to be aware of. Sleeping promotes recovery. Okay, it's really good for recovery, especially for endurance performers. So first of all, our triathletes, our marathon runners, sleep is brilliant for us. We really recommend. Now that doesn't mean it's not important for strength athletes, of course it is, but particularly for endurance performance, really important. Secondly, it's all about sleep quality, not quantity. So sleep quality is something I really want you to switch on. Sleep quality is critical, and I'll talk about quantity as well in a second. So what are we talking about here? We are talking about the ratio of sleep. What have I written? Sleep to time in bed. Okay, to time in bed. So, lots of people like their bed, don't they? But what we're saying is that a ratio of 85% of sleep time is optimal. So if you're someone who'll go to bed and watch 3 films before you go to sleep and then sleep 4 hours, that's going to be like 50%, right? Here, we're talking about 85% of one's bedtime should be done sleeping. Have a little reflection on that. That's interesting. Second one with quality of sleep, we want to know the difference between REM sleep, which is rapid eye movement sleep, which is considered to be much deeper, and it should be about 20% of our sleep patterns, to non-rapid eye movement sleep, which should be about 80% of our sleep. And that's the sort of ratio we're looking for in achievement there to get the best possible recovery and adaptation process. Also, this is a really important one for you kids, youngsters, adolescents, teenagers. Devices restrict sleep quality. Now, I don't use a device like a mobile device. In bed, what I do is I watch a TV program or two, or I watch a film and things like that. Now, we're arguing here that it's better that wouldn't be the case. Now, it's not always easy to necessarily not do that. Some people would argue it is, but actually sometimes we get a little bit sort of reliant on these things, but it's something that we want to be aware of. Also, we want less than or equal to 15 minutes to fall asleep. So think about that yourself, folks. Are you falling asleep in 15 minutes or fewer? If you're not, that is something that perhaps you want to reflect on and maybe sort of try and work towards if you think it's interesting. Now, last point before I get into my last sort of detail of today. So basically, depending on our training load, if our training load goes up, if we're doing lots and lots of training, then our sleep requirement needs to go up, okay? So that's not a difficult point, that's fairly simple. But what we're saying is sleep needs to increase if training load increases as well. And then finally, guys, just down here, I just want to make a bit of a general point here. I just want to talk about travel. Okay, I just want to talk about travel now. This is an international course. This, you could be traveling a great deal. I want you to introduce you to the real condition that is jet lag. I've only experienced it seriously once in my life. It was absolutely horrific, but it's really important that athletes are allowed the opportunity of acclimatization or acclimatization. What have I written? I'm not sure I've written the right word there. Or acclimation, we can say. Now, we often think about this in terms of weather conditions, altitude, but we're talking about this temporally in terms of time as well. Also, I want to introduce you to a concept called travel fatigue. Travel fatigue is not jet lag, but it is sort of a level down from that, and it always happens, okay? It's less impacting, but it will happen with lots and lots of travel. So if someone is traveling to compete, this and this and this are critical consideration, because otherwise performance quality will dip. Cheers.